My name is Maureen Harrington O'Neill. I am the Assistant Director of Development at ACR Health, and I am joined tonight by Allison Matura, Development Associate at ACR Health as well. And we would like to welcome you to the Hike for Life Wellness Summit, a 23-day community wellness event that will be wrapping up on May 15th. 23 days to celebrate 23 years. We are very excited about this. It's really been a remarkable year for us, just because, well, for all of us. I mean, it's been, overwhelming for all of us while we're staying home and trying to navigate new surroundings. And I think a lot of health issues have come up for all of us. How do we stay healthy? How do we eat healthy? How do we pay attention to our own self-wellness, right? But we have been really overwhelmed for the support of our agency, because we have incredible sponsors for all of our events, and we have incredible partners in our community. And one of those incredible partners is joining us tonight. And we are very excited because they're going to share their own wellness journey through COVID and the services that they provide, not just to the community as a whole, but also to their own workforce. And we know that's why they stay strong for everyone else as well. So we're very excited for them to share their secrets with us. Tonight, our sponsor recognition goes to MVP Healthcare, and we are thrilled tonight to hear their presentation, Living Well. So please join myself and Allison in welcoming Outreach Representative at MVP Healthcare, who has been there for a remarkable 23 years. That's how much she loves her job. Pam Kennedy. And Stacey Perez, who's the individual product advisor. So thank you, ladies. Welcome, welcome, welcome. And thank you so much for your support. And thank you for joining us tonight for this presentation. We've been looking forward to it all week, and it's a great way to end our week, right? Pam, can you start us off and let us know a little bit about yourself, and let us know what you do at MVP?
Well, fine. I'm very glad to be here. Thank you so much, Mo. I am, as she said, Pamela Kennedy. I have been with MVP for 23 years. 23. It's just something going on with the number 23 right now. But I have been, as I said, with 23 years. I started out as a customer service rep, which I worked with mostly employer groups. And then I ventured into Medicare. And then I ventured into retail outreach, which gave me an opportunity to go into the community and meet with people and to talk to them about healthcare and the benefits and how easy it is to acquire healthcare. And then I was actually asked to go into the leadership position, where I have a territory that covers everywhere from Rochester, New York, down to Schenectady. So, and I have a wonderful team of 7, and one of them includes Stacey, who is right in your back door. She's right there in our Utica office, and she will be our presenter this evening. And so I hope you join me in welcoming Stacey as she begins to tell you a little bit about MVP and what we have to offer.
Thank you for having me. It's really a pleasure being here tonight and being able to present to you guys what we do at MVP. So my name is Stacey Perez, and I've been with MVP Healthcare for 4 years now. I have to say I definitely love my job because I love being out in the community. I love helping people. Like Pam mentioned, we are out in the community helping people enroll in health insurance, letting them know that it is easy to do it. And we can see someone, let's say in, I don't know, McDonald's. And if they need help and they need enrollment, we sit there with them and we help them enroll. So that's how easy we are and how accessible we are to our community. I also am a certified application counselor through New York State of Health, which means I can enroll individuals on the marketplace. I am licensed through New York State, which means I can enroll individuals off exchange and Medicare as well. So again, we do we help everyone in the community. I help people from birth all the way to Medicare. So we cover it all. So I am going to start off with explaining the Affordable Care Act. And the Affordable Care Act has three primary goals. And the first goal is to make health insurance affordable to more people in the community. It expands the Medicaid program to all adults with income below 138%, and it supports advanced medical care delivery to lower health costs of healthcare generally. So with the Affordable Care Act, 10 essential benefits came. So basically, New York State is telling us um, health plans that we have to provide 10 essential benefits in every plan that we offer to the community. And these are medical room visits, emergency room, visits, ambulatory care, laboratory services, maternity and newborn care, mental health and substance use, oral and vision services for children, hospitalization coverage, prescription coverage, preventive and wellness services, which is basically physicals, mammograms, and things like that that we do for preventive care yearly, rehab services, and chronic disease management. So now I'm going to go over the New York State of Health sponsored health insurance programs, also with the MVP plans. So the first program that's offered through New York State of Health is Medicaid Managed Care, and Medicaid is a health insurance program for low-income children and adults. It is based on income and family size, as well as citizenship and immigration status. Medicaid is also available to people of any age who are blind or disabled. And here you can see a map of our service area along with the income guidelines. So basically, who would qualify for Medicaid based on family size and income. Next is Child Health Plus. Child Health Plus is a New York State sponsored health insurance for kids who do not qualify for Medicaid. Almost all children under the age of 19 qualify for health insurance, regardless of the family income or immigration status. Again, here you can see a table with how much a family can make in order to give you the exact amount of how much they would be paying for Child Health Plus, depending on family size again. And it could be from $0 all the way to $9, $15, $30, $45, $60, or the maximum for each county, which is different for every area. And again, a coverage map for Child Health Plus. We also have the Essentia Plan, which is one of my one of the best programs that I like myself, because the Essentia Plan is available for low and moderate income New York residents who do not qualify for Medicaid or Child Health Plus. And it's for people who are like in between those Medicaid and like a qualified health plan, which is the private plans. So they offer the same benefits as any other plan with low cost. So usually with the Essential Plan, someone would have a $0 or $20 premium, but with the American Rescue Plan now, New York State is having everyone under the Essential Plan pay $0 a month for premium. So this is a great program. Again, this is why I mentioned that this is one of the programs that I like the most, because it's very, very affordable to our community. And again, like I mentioned before, here we have a table of how much an individual would have to make in order to qualify for a Essential Plan, and also our service area map. Medicare. So Medicare is a federal program for people of age 65 and older with people with certain disabilities, such as end-stage renal disease. Medicare is eligible for, individuals are eligible for Medicare Parts A and B during the 3 months of their 65th birthday, the 3 months before their 65th birthday, the month of their 65th birthday, or 3 months after. So they give them a 7 months period to apply for Medicare. And they can apply for Medicare by calling the Social Security Administration or visiting the website. MVP also offers MVP Medicare Advantage plans. We do have some $0 premium plans in certain counties, as well as patriotic plan that is available to the VA community. One of the great benefits that our Medicare Advantage plans has is the zero cost Silver Sneakers membership, which is free fitness membership to members of our Medicare Advantage plans, and they can visit over 1,600 locations nationwide. This is a great benefit that our Medicare Advantage recipients get. And lastly, the last plan that is available through New York State of Health is our qualified health plans. So qualified health plans is ideal for those who cannot get health insurance through an employer, or for example, if it's cheaper to get it through New York State of Health than to get it through an employer, because New York State of Health helps people with a subsidy. So basically it is an advanced premium tax credit that New York State gives the community, the people in the community based on income and family size to help them pay their premium for their plans. So right now, again, with the American Rescue Plan, New York State of Health increased the amount of subsidy that they're giving to the community, which is great because people who were not able to get a credit before are now getting credits, and those who already had credits are getting even a bigger amount of credit. And we know this is great because a lot of people were struggling with how much they were paying for premiums, even though they were already getting that credit. So it's definitely a great thing that happened for our community. Qualified health plans are also available to be purchased directly through MVP Healthcare at full cost. Whether you do not want to go through New York State, or if you do not get any tax credit, you have the option of just applying through MVP directly. We also have our Living Well programs, which are available to both members and non-members, which I think is great. We have the Ongoing Fitness, which are weekly fitness classes with a focus on improving participants' strength, balance, flexibility, and cardiovascular health. We have our presentations, which are interactive educational programs devoted to self-care, chronic condition management, and wellness, general wellness. We have a program series, which basically provides exercise and education shared with participants as a tool for effective self-management. We also have our unique educational programs, which are dynamic and interactive offerings that build on the dimensions of wellness through intergenerational, hands-on, outdoor, and other creative programming. And lastly, we also have special events in the community that gives us an opportunity to collaborate with other departments, engage in our demographic dynamic activities, and it promotes MVP and our Living Well programs. Okay. And lastly, if anyone has any questions for us, we are here to answer them.
Well, before we go into a couple of the questions, I would like actually, Stacey, if we can go back and talk about the Medicaid and especially the Essential plans.
Okay.
Those are two great plans. Medicaid, everybody, a lot of people have heard about that. It's, she said, for lower income. And sometimes, if in fact you have recently been laid off, you're no longer under an employer group, you become eligible for Medicaid. I know sometimes people are like with the stigma, but I often tell people it's good for a year. It allows you to come back and get reestablished into the community once you do get a job, but also it will give you the opportunity to maintain your health. You have no co-pays for your doctor's visits, your hospitalization, and no more than $3 for your prescriptions. With the Essential Plan that she talked about, that really made some big changes. It works well for students. Let's say that they work a part-time job, or for people who are not eligible for Medicaid. Maybe I'm a part-time worker and my income is around $24,000 a year. Well, this is where the Essential Plan came in. And again, actually as of June 1st, the cost was $20, but it now will have 0 premiums. And it will also include a dental and vision coverage, which previously you had to pay anywhere from $15 to $20 to add on just the dental. So going from possibly a $40 plan to 0 is definitely a great benefit and a great opportunity to expand everyone's opportunity to have healthcare coverage. And this is something that is a little unique for New York State, the reason why we pay the extra taxes. But also what the difference between this and the Medicaid is that with the Essential Plan, there are some copays, very low copays, no deductibles, but you may have a copay of $15 or $25 depending on who your provider is. And you still have great prescription coverage with no more usually than $15 to $30 for your prescription coverage. So these are 2 great plans that we want people to know they are now available and more accessible to more people who previously did not qualify. Not every state does the Essential Plan. It is unique to New York State. So you can get an opportunity to see a little bit more where your taxes go. So, and lastly, on the qualified health plans that Stacey mentioned, that one is a little bit more like an employer group plan. You do have deductibles. But again, the premiums, while it may say one thing on the information, based on your household income, your premium can go down to $50 a month, and it could have been a $300 plan. So we want to make sure that people are aware. Do not just say, oh, health insurance is just too expensive. Give us a call. Let us see what we can do for you. You may now qualify for more than you thought. And it's really extremely easy. It takes about 15 minutes to do most of our plans. And we do it right over the phone with you. We also will go over any prescriptions that you have and basically make sure that all of your needs are taken care of. So we want people to know it's easy, it's more affordable now, and that we are definitely here to give you assistance. So Stacey has left her information. Again, she is your local outreach coordinator, and she works with all of the plans. Oh, and of course, our Medicare, which has the Silver Sneakers. Part of the things that we do with the Silver Sneakers program is we have walking programs, as Stacey mentioned. Some of our courses that we offer, it's not only for members, but it's for people who are not members. Now, you might have a little cost to it, $10 or $15 to join, but the key is getting the community to stay healthy. I personally used to do I was doing a Pilates class that was with them, as well as a breathing class. And you will find that people are very easy to talk with, and you get a camaraderie. And you look for people. Where are you? And we even had a story one time through Silver Sneakers of a couple who got married. So you never know what you're going to find when you come to some of our wellness programs. And I think Mo mentioned that you can check our website mvphealthcare.com. It will take you into the different programs. You would be amazed at the things that we do and provide for our customers. And hopefully soon, you'll be able to even see us out in the community, because we come to different farmers markets, and we were at the Jazz Festival that was happening last year. Oh, sorry, 2019.
It used to happen.
Yes.
But
Thanks, Pam.
see us out in the community.
Pam, we've got some questions for both you and Stacey in the chat.
Stacey,
So
I'll
I'm
turn
just
it back
wondering
to
if
you.
I can ask you a couple. So when, I love this idea that you guys are out in the community and you're helping people wherever they are with their insurance needs. Is there a cost for them to just meet you and find out the information?
It's totally free.
So absolutely no cost to actually find out whether or not you have the best plan for you at that time. So it's kind of a win-win situation for everyone involved.
Definitely.
Yeah.
We
Yeah,
just
that
want
is-
everyone to at least ask the question to find out. That way you are informed.
Yes. Yeah, exactly. Because you could be
Knowledge is
getting,
power.
yes, exactly. And it's also healthcare.
Yes.
Yes, it's health, which is wonderful. And there's another question. Someone wants to know, what kind of barriers, you guys are out in the community, so you're really, face to face with people in very real situations. What kind of barriers are there that keep people from getting insurance? What are some of the barriers that you find?
I would say definitely thinking that it's going to be very expensive, because we're talking about health insurance. Like we said before, people are not going out to get educated because they assume. So, we always tell people, don't assume, come get the information. Just because you come and do the application doesn't mean you have to sign up. So definitely, I think that's one of the most barriers that we get for people who do not have insurance. And also some people, you would even think, people would think there's more out there, but some people think that if their employer group offers health insurance, they have to go through them. And some people cannot afford it, so they won't go through them and stay without health insurance. And this is what we're here for. This is what the qualified health plan is for. This is what the essential plan is for those people who are working and do not make enough money to afford a health insurance through their employer, or who can get the extra help for the tax credit through New York State of Health. So that's a very important piece of information that I think we have to get out there, to let people know that they can enroll in health insurance through New York State, even though their employer's group coverage gives them health insurance.
And if I
Nice,
could
that's
also
very good to
interject,
know.
I forgot about the Child Health Plus. You can have employer group coverage. Let's say the mother and father are working and you have the kids, but you have a high deductible plan. That's where Child Health Plus can come in. And they, under Child Health Plus, one, you would change the family dynamics, because you would your kids would go to Child Health Plus. They would have all of their doctor's visits, eyewear and dental covered, or with prescription covers no more than $3, but it would be covered with no cost. And then the mother and the father, or the single person, can then change their health plan and reduce or save money through the employer group. So Child Health Plus is one thing that I was not aware of, but I wish I was when I was working, because I would have definitely put my children on Child Health Plus.
Child Health Plus is, it's really been a lifesaver for so many families
Yes.
during the COVID pandemic, right?
Yes.
So many insurance people, so many people have kind of changed their insurance needs. Some people got maybe furloughed or got let go completely. And so, families that had secure insurance, if there's one thing that they know when they leave speaking with you tonight, it's that they should just call you and get in basic information about what you can do for those changing needs, those lifestyle changes that they may or may not have had happen to them. And the Child Health Plus, again, I love this program. It really has, like I said, it's been a lifesaver for families with children. And it's very inexpensive, and it is a wonderful piece of, insurance for any family. Yeah, it's a wonderful program. It really is. I have one more question. I'm sorry, and then I'll stop talking. I'm fascinated by this. So your Living Well programs, when people sign up for these, because these are great, right? I mean, there's fitness and there's education, there's yoga. I mean, you guys get down into the nitty gritty about breathing, which we've heard so much about. You can't imagine how many people have mentioned just breathe,
Yes.
And I'm sure Allison will talk to you about that a little later, as being our resident yogi. But I think that when people come in for a Living Well program, do you also kind of talk to them about the insurance as well, so that they know that they've got that opportunity to just shift? And
Actually, we keep it towards, the reason that they're there. There is, of course, information around, but we do not have a representative there to actually talk about the options. They're there for the health program, and we try to keep it that focused. And that's how we operate, and it seems to work well.
that's fantastic. And can you just, you know what, I'm going to let Allison actually has a question, so I'm going to hand this over to her. Allison, you want to talk about this?
I do have a question. I have lots of questions. And
I know.
I've I have had insurance. I've listened to insurance presentations many, many times, and I've learned so many things. I mean, the fact that you don't have to now choose your employer's insurance, I think, is fantastic. We have amazing coverage, but in other positions I haven't. And I've also experienced that super, super high employee +1 rate that's family, which is so much. And just knowing that there is that option of, being able to use Child Health Plus it's a huge relief, because that's such an important, insurance is so important to me, because I have a history of health issues. So I know how important it is to have that safety net.
Exactly.
But the chunk that comes out of every paycheck, it's kind of like paying for daycare. Like, you're making the money to just hand it over to different people. But when you land up in the hospital and you get the bill for 500 versus whatever thousand, it's just. So my question relates to preventative health. More and more and more, I see the effort that's being put into preventative health from insurance companies. And from your perspective, I get it from the employer perspective, I get it from my perspective, but I want to understand more from your perspective. What is the investment or the return on the investment in preventative health care?
Definitely lower cost. You prevent yourself from getting into the hospital. If you don't have, let's say, your mammogram, I hate to go there, but your mammogram, your colonoscopy, or if you go too late, as opposed to seeing your doctor on a regular basis. But if you go too late, you may be in stage 4. If in fact you do not have health insurance, and I've seen it, a weird thing, you're playing basketball, you don't have health insurance, and you don't go to the doctor after you bench your finger, and you just keep your finger where it could have been just a quick straightening out. So the health insurance and having access to it is so important, but preventative is just what it says. It makes sure that you are aware and you keep ahead of any major or serious problems. You don't want to find out that you're diabetic and you have to go straight on insulin. No, you would like to talk to your doctor first and keep an eye on your lab work. And that way you prevent that, or you try to avoid it as much as possible through probably taking nutritional classes. And remember, with preventative, colonoscopies, mammograms, oh, I can't think of anything else, but those preventative services are covered in full.
Right.
Your wellness exam, which minimum a year, depending on your age level, twice a year, every 3 years. But you should go to those because they cost you nothing. Same
Right.
for the colonoscopy, same for the mammogram. So do it because of the fact that you just save yourself a lot of grief, your family a lot of grief, and you keep yourself in a healthy state.
I have a follow-up. Not
Uh-oh.
surprising, I know, to Mo, that I have a follow-up question. I understand. So I guess the context of my question is a little bit of, I always feel like people say bad things about insurance companies. But what I see is that, your statement about we do this Living Well program specifically, for example, because we want the community to be healthy.
Yes.
And so I'm seeing through, much more push. I mean, I don't know if insurance companies have always focused on preventative health, but lately it is especially through COVID, the importance of it has become so much more. And so it's interesting to look at it from a different perspective.
Right. And, the meditation, it keeps your mind, helps to keep your mind. It gives you that social outlook because we've changed to the video where we used to be in actual facilities,
Yes.
doing it online. And so you have that social ability, you have the ability to just exercise, to keep moving, to hopefully prevent falls because, if you're exercising, if you're moving, you're able to keep everything limber. So to me, that's also a part of the prevention because of the fact that if you do these things, you don't have to worry about going to the doctor as much. You don't have to, possibly can avoid some of the doctors, seeing doctors that you don't have to see if in fact you were social with someone, and we do it through, we offer it for free. So why not take advantage of it? Exercise, especially as you get older, really makes the difference. When you get up in the morning, how stiff am I or how limber am I? I'm just to put it very simple.
So
For
your
sure.
policies are really rewarding people for paying attention to preventative health care
Yes, it
and
does.
making sure that those beginning stages of healthcare are taken care of and they're free.
And with the Silver Sneakers program, they actually do have a reward program associated with how many classes you take or how many visits to the gym you make, which Stacey did mention. You have access to gyms not only locally, but when you travel for those snowbirds, you can go to Hawaii, Tampa, or Miami, or Phoenix. I was surprised when I went out to Phoenix and I saw the Silver Sneakers, and they were like, yeah, we definitely accept them. So, it's all about staying healthy, part of the prevention, not only the ones when you see the doctor, the mammograms, but also the prevention in just keeping your body active and healthy.
I have a personal question because I know you're in healthcare, and I'm lucky enough to work with a yogi. So I'm always going to a yoga class, although I have put on a few of those COVID pounds. But I'm just asking, I'm just curious because I think that it's kind of motivational for all of us. What were some challenges for you personally? Because I kind of sometimes I get the feeling like there's a little bit of pressure, right? We work in healthcare. So there's a little bit of pressure to be healthy. But I do know that there were challenges for me. So what kinds of things did you do to kind of stay on course and remain healthy and motivate yourself? Like what kind of things did even MVP do for their clients or their workers?
Well, we have offered different classes for the workers. We do have lunchtime classes anywhere from yoga to strength training. We've offered classes on healthy eating, Mediterranean style dishes. For myself personally, I stretch in the mornings And then I take a walk, 20 minutes to 40 minutes, depending on the day, I even walk in the winter. I put on my boots and my heavy coats. It could be 20 degrees. I get ready, I go outside. I truly believe in getting fresh air. I work from home. I need the fresh air. And that's what I tell to my team. When we've had a rough morning, I'm like, okay, everybody, let's go outside. Let's go get some fresh air. So that's helped me. And it's also helped me maintain. So I didn't really catch the COVID-19, but it did keep me, it refreshed me, and it allowed me to come back and continue the work for the rest of the day. So I will walk in the morning of 6 o'clock. I will walk at noon, 12 o'clock. I will walk in the evening, 5 o'clock.
Stacey, what about you? Oh,
So-
I'm sorry, Allison, do you have a question?
I was just gonna, I want to hear about Stacey, but before I forget my question, I want to know more about the employee wellness that you all get through MVP as well, like that investment in, your own, and has that changed with COVID?
Actually, it's become more accessible because of COVID, because we're home, people are able to take a little bit more advantage. They give it at different times of the day, noon time, they give it at the end of the day. But again, having the access to variety of classes, as I mentioned, the yoga, the Pilates, the strength training. I can't remember if they did the Zumba still. I know they were for a while. And as I said, they're offering cooking classes. They are offering a mindful meditation. I haven't done that yet. But as well as they recognize the fact as an employee, they recognize the fact with the change that some of the parents have kids at home. So they've made it a little bit more flexible for us. You got to take your kids sometimes, or, and so we allow for a little bit more flexibility when that happens. So they've allowed for a lot of the changes. Working from home, you don't have that opportunity to leave, get up from your desk and go as much as you used to. But we recognize that, and we just try to work with everyone and their schedule. It's a little bit more individualized because everyone is different. So we take that into account. And so, Stacey, I'm going to turn it over to you, because we do also have more to come besides us talking.
Yeah, so what I do is I try, because I can't always do it. I have twin girls. So my
Just a
husband,
year old.
yep, 1 year old. And they were COVID babies right before COVID hit, February 29th. So my husband gets up at 5 o'clock in the morning to go to work. So I try to stay up when he leaves and exercise. So I do yoga, I would do a YouTube video, but that's if the girls let me, because sometimes they would hear us and wake up. So when that happens, I would do it during my lunchtime. If the weather's nice out, I would go on a walk with them. We would go to the park. I'm also a strong believer in taking fresh air, taking a break from things, because it just sets your mind, it sets your mood to being refreshed and keep going, because it could get hard, with work, the girls, home, it's a lot. So definitely, I think exercising, walking does that to your mind, where it boosts you. So yeah, definitely that's what I do to stay healthy. Definitely the healthy eating. I am a big green juice drinker too, so yeah.
And I have seen personally that it can, if you don't take care of yourself, if you don't take the time, I know people see it a lot of times, you've got to take care of yourself, you've got to take care of yourself, but I have seen the effects of it. And I have seen that people really have had some mental issues in being able to cope. And I also know that they have not done things to take care of themselves, such as walking. They might have a dog, but they have a dog walker. So, I'm like, go out, take that dog, get the fresh air, don't just stay in front of the computer all the time doing work. Take time for yourself. Try it. You'll like it.
I like that advice. That's great advice. All right, we're going to let you continue talking about your programming. So take it away, ladies.
I believe Allison has something from our well-being program that she'd like to share.
What I'm just taking control back. Does everybody see my screen?
Yes.
So we are going to share, there's been a lot of conversation throughout the call about taking a breath and, not only for your, clients, but for us personally. And so we, as Mo mentioned as well, I am certified in meditation as well as yoga. So it's whenever I hear somebody reminding us to breathe, it's really attractive to me. So I'm going to share this amazing resource. I'm talking. This amazing resource that MVP has on their website. As you said, these are for everyone to access. And so we thought it would be a wonderful way to end our the presentation portion of this presentation by actually doing, it's 14 minutes, which may sound daunting, but as a frequent meditator, it is amazing how with practice you can definitely still your mind. So I'm going to encourage you, the narrator will talk you through it, but I'm going to encourage you to just take a nice comfortable seat and make sure either you're scooching forward in your chair so that your spine's nice and straight, or just on something nice and secure. And I'm going to start this.
Hello. Welcome to the breath meditation. Your breath provides a natural point of concentration, and by focusing your attention on the breath, you begin the process of training the mind to center yourself in moments of stress. Additionally, you elicit a nervous system response that relaxes the bodily systems and begins to change your blood chemistry. Breath meditation has been around for thousands of years and is foundational in a consistent meditation practice. Let's begin. Find a comfortable seated position. Allow your eyes to close softly and allow your focus and attention to draw inward, finding a smooth, easy breath in and out through your nose. You might imagine taking a seat underneath a tree in a meadow where you're safe and protected from the enveloping canopy above. Using this natural flow of breath, begin to observe the breath. Notice the movement of breath from just outside the nose, how it passes over the upper lip and through the nasal canal on the inhale, and then tracing it back outward on the exhale. Continue your focus in this area. As you breathe in, notice the cooling sensation of the breath entering the nose. And as you breathe out, notice the warmness. You see, as air enters and exits the body, oxygen is exchanged with carbon dioxide. And in that process, quite naturally, the temperature will change. See if you can notice that change right inside the nose. Sense now the depth and smoothness of the inhale and exhale. And wherever you are, you're not trying to change the breath. Rather, you're watching, listening, and observing. With each inhale and each exhale, allowing that relationship with the breath to deepen. And if at any moment you notice your mind drifting away from the breath, and you begin this process of thinking on other things, just softly and gently bring that attention back to the breath. We do this repeatedly. And this is exactly how we train and conquer that often reactive and unruly mind. Breathing in through the nose, breathing out. Shifting attention away from the nose now, focus on the feeling and movement of breath in the chest. Breathing in, breathing out. Notice the rise and fall of the chest, the natural expansion and contraction. Identify that cadence or tempo of breath inside the chest area as it rises and falls. Focus your attention on this pattern of breath in this area of the body. Once again, just breathing in through the nose, filling up the lungs with air. Breathing out, letting it go. Often in meditation, our minds can run wild with thoughts as we've trained ourselves to move on to the next task on our to-do list. See if you might acknowledge these thoughts as they come up, and just return back to the breath. Our minds are like a wild horse brought in from the plains to work on the farm. The horse is our mind. The plains are the constant blitz of stimuli. And the farm, well, that's how we interact with the world, or where and how we live our daily lives. Like a wild horse, we can tame the overactive mind through repetition and focus. And if we do it from a place of non-judgment, strong character, acceptance, and patience, over time we can take control of the wild horse running in our mind. And in doing so, we take control, or we take more control over our lives. We no longer overanalyze what we're thinking. We just witness and observe the tendencies of the mind. Because to change our minds, we first need to get to know our minds. So whatever state your mind is in now, be friendly towards it. as you come back to the lifelong dance of the breath. Breathing in and out through the nose, watching the breath expand and contract in the chest. Maybe by now you found a really nice rhythm and flow of the breath. Begin to shift that attention down to your navel or belly, finding now the rise and fall of your abdomen. Breathing down into the lower lobes of your lungs, watching the belly lift. Observe now how the breath interacts and moves around this part of your body as we continue to train the mind to go exactly where we want it to go. Sometimes the distractions are never-ending, but sometimes we slip into this mind-body state of deep concentration, and your presence becomes clearer and deeper with each passing breath and with each rise and fall of the belly. Seemingly to no end, we might have no interest at all in moving out of this place of stillness, this place of meditation. And in this place of stillness, allow the focal point of your breath to fade away, where there is nothing particular to focus on. As you resume sitting comfortably and quietly in total union with mind and body. If you happen to be experiencing any anxiety, stress, or maybe loneliness as a result of the situation we're in, or maybe your own personal circumstances, just know that these are all messengers. And in meditation, we sit in self-examination and we begin to decode these messages or decode our emotions to make better sense of our condition. The renowned psychotherapist and Holocaust survivor Viktor Frankl once said that we who lived in concentration camps can remember those who walked through the huts comforting others, giving away their last piece of bread, They may have been few in number, but they offer sufficient proof that everything can be taken from someone but one thing, the last of the human freedoms: to choose one's own attitude in any given set of circumstances, to choose one's own way. You might even ask yourself the question, how will I respond to what's happening around me? And in answering that question, knowing that there is a choice for you to make, and that choice is all yours. From here, take a deeper inhale through the nose, filling up your lungs with air, holding the breath at the top. And then exhale, sighing it out through the mouth. We'll do that 2 more times. Good. Big inhale through the nose, pause at the top. Exhale, letting the breath go. Last one. Big inhale. Suspend at the top. Big exhale, letting it go once more. Take your arms overhead as if you're waking up from a long night's rest, and stretch your arms up. Begin to flutter your eyes open. Good. Hands come down, hopefully returning to your day a little bit more centered, a little more calm, and knowing that between stimulus and response, there is a choice. Let that choice be well-meaning for you and those around you. Thank you for your time today, and thank you for your meditation practice.
Way to
So that
end.
was 14 minutes and like 52 seconds or something like that. So what an amazing, just thank you, both of you. Thank you, Stacey. Thank you, Pam. Thank you, Paul, Ken, for joining us. I think it just, I think that, yes, that it's just an amazing partnership between what we're doing, what you are doing, and sharing it with the community. We're very fortunate to have you as our partners, and also to have you as an active player in community wellness. So we appreciate you. We appreciate the work that you do. I want to do
that was a perfect way to end the week. Thank you so much.
Yes,
That was really
yes, for sure.